Hi, I am Dr. Madhuri and I am from Évoluer Aesthetics and Plastic Surgery. Today we'll talk about fillers. Fillers are all over the place these days and it's the most happening thing in the aesthetic industry. So what are these fillers? Let's know detail about this. What are dermal fillers? So these are the substances where we can inject just below your skin surface to get the hydrating look on your skin and also make it look more plumper and also get the contour of the face. So these are of different types. Let's go in detail about what are these. Dermal fillers are of different types. So basically these are hydroxyapatite hyaluronic acid, polymethyl methacrylate and polylactic acid. Some of them are biodegradable in nature, not all of them are. Who can get the dermal fillers done? Anybody with a concern of volume loss, wrinkles, scars and contouring of the face can get this procedure done. So what are the indications of this? There are various concerns which the dermal fillers can help, one of which is the volume loss. So volume loss can happen from all over the face. So we'll start off with initially from forehead. We use the dermal fillers for the wrinkles and the fine lines. We also use dermal fillers for the nose, and this is also called liquid rhinoplasty. We can also give the dermal fillers for the lips to get the plumpier and a pouted lips, and we can also give for the cheek to get the contoured and sculpted face, for the jawline to have that sculpted jaw, and also for the neck so that you have a hydrated neck. Okay, dermal fillers can be used in various places. Let's talk about individual places. Most commonly it is used for under eyes, lips, cheeks, nose and jawline. So for the nose it's called liquid rhinoplasty, where we can shape the nose smoothly. Some of them will have irregular bridge of the nose, so that can be corrected. Coming to the under eyes, some patients who are having hollow eyes and darker and dark circles, that's what we call, so that can be corrected up to certain extent with the fillers. And coming to the cheeks basically gives you that 3D structure and contour to the face. So to get that sculpted look, it's always to go with the fillers, because once we put in the fillers you get that neat contoured face, and where you have the tightening of the face, the anchorage points for the face. And now coming to the lips are one of those features of the face which makes the person more attractive. So with the help of fillers we can definitely do the lip filling, and it will give you a good plumped look to your lips, shape, and also gives a hydrated look to your lips. And the jawline, most of our patients come here to get the sculpted jawline and the chin, and this is basically to get a straightened jaw. And some of them who don't have the chin, which we call is our hyper chin, that is hypertrophic chin, so we can create a chin size with the help of fillers, and this typically lasts for about 1 year and above. And to the neck, basically it is to remove the signs of aging, smoothen the wrinkles and lines in and around the neck. So overall, fillers are the non-surgical best options to get the contoured face and just reduce the signs of aging, maybe for like 1 to 2 years down. So how to choose the right clinic and the correct doctor for your dermal filler procedures? First thing to be considered is looking at the safety. So we have to make sure that we are in the safe hands, and also we have to be careful while choosing the product. The product that we choose is directly proportional to the complications that we might encounter. So choose the clinic or the doctor who makes sure that your safety is at the priority. Second thing is having the proper certifications. For example, the experience of the doctor, the certifications of the doctor. Choose a well qualified, experienced person so that you have the least complications that you might encounter. The next thing is reputation of the clinic. This is also equally important. Why? Because unless and until you have a good reviews and reputations regarding a specific clinic, that is something that we need to look for. Another thing is comfort of the patient, and during the procedure and also during the consultations has to be a priority. You should be free and you should also feel very comfortable to ask all the queries and questions regarding the procedures that you will get it done. So feel free to ask all the queries regarding the fillers. Steps involved in doing the dermal filler procedure. So basically you will have a consultation with the specialist or the doctors. So they will look at your face, assess what is required and which category you fall under to select which type of product is required, and then finally help you with a suitable product to use. The second thing is we prepare you to get the filler done with some numbing anesthetic cream so that you don't feel any kind of pricks with the injections that we give. The procedures is around 45 minutes, which includes the anesthetic cream. Doing the procedure varies, depends on the areas that we are doing. If it is a smaller area, it's very quick. It ranges from 10 to 20 minutes or maybe 30 minutes. And technically it's called lunchtime procedure. It's a quick procedure where you can come, you can get the procedure done and go back to your work. And the next is your recovery time. You'll hardly have a recovery time because it's just a very small procedure without any downtime, so you can immediately get back to your work. And post instruction will be given to you what to do and what not to do after the fillers, so that you're well prepared, and also the medicines that you're supposed to take will also be provided, so you know what you can expect out of the fillers post the procedure. So what are these risks and expected side effects of the dermal fillers? Potentially the dermal fillers have certain risks, and these are absolutely in relation to the person who is injecting, the product that we are using, the longevity of the product, and various several factors associated with it. Ideally, if the procedure is done properly with the knowledge of the person who's doing it, you will not encounter any kind of side effects or a complication associated with it. However, the most common ones are swelling, bruising, some allergic reactions, if at all you're allergic to that particular product that we are using, and pain and nerve damage, irregularities after the procedure is done. Say example, we are going to give you the fillers in the area where, say, lips, so you might encounter some blebs, irregularities when you touch the lips. So these are very common ones where you see as a side effect. Dermal fillers, how effective are these? So basically this is one of the most popular non-surgical options for treating the aesthetic concerns, and this depends upon individual requirement, and also depends, typically this can last for about 1 year and above, and it is totally depending upon the concern and the metabolism of individual. However, all of different types of fillers is absolutely based on the manufacturer and the concern of the patient. Coming to the cost of the fillers, this is absolutely depending upon the type of the fillers that we use, the location of the fillers that we are putting in, and also individual. That is because we need to make sure that what is your concern and how are we going to treat your concern with which filler. So because there are different types of fillers available in the market, we have from the highest of the highest to the lowest of the quality product, but the best and the US FDA approved product is always a priority. So choosing that product for the safety of the patients has also to be considered. Just because it's a low priced filler, please do not choose to go with that. It also has equal complication associated with it if it is not an FDA approved product. So costing is totally dependent on these factors, so choose wisely.